Want to thank everybody for joining us here today. Definitely excited for this conversation. My name is Bradley Schleier. I am the VP of Sales here at HealthBook Plus, and I'm joined today by Ryan Wendling, our VP of Solutions and Success. I'm going to spend just a few minutes setting the stage, what we're seeing in the market, why care navigation is becoming such a big focus, and where HealthBook Plus can really help. Then I'm going to hand it over to Ryan, who's going to show you the platform. He's going to start in the clinician portal first, because that's where your teams are living every day and where operational value really is going to show up. And then what he will do is he will move into a patient experience to show how HealthBook Plus keeps people connected and engaged between interactions. Now, the goal is today is very simple. We want this to be useful. We want you to leave here with a clear understanding of what HealthBook Plus does, why it matters, and whether it may be a fit into the work your team is already doing. So what we're seeing right now is that care navigation teams are being asked to do more than ever. You're being asked to help people find the right care faster, reduce confusion, support chronic disease, improve engagement, reduce unnecessary utilization, and really, at the end of the day, prove value back to the employers, the health plans, and your partners. And in most cases, you're being asked to do that without a huge increase in staff time or resources. And I think that that's the hard part. The expectations are absolutely going up, but the resources are not always going to go up with them. And from what we see, the issue usually is not the care team. They understand the patient, they understand the workflow, they understand how complicated healthcare actually is. I think that the real issue is that they're often working with incomplete or scattered information. So, for instance, a patient story might be sitting across multiple EHRs, PDFs, portals, claims files, notes, wearable data, even spreadsheets. So before someone can actually help the patient, they have to go find the story first. So they're looking for records, they're reviewing charts, they're piecing together what happened, and then they're trying to make a good decision about what should happen next. And that is a lot of work before the actual navigation even starts. And that's where HealthBook Plus fits. So we help care teams get the patient story faster. HealthBook Plus brings together clinical records, patient-reported information, and real-world health signals into a more complete view of the person. And then Paige, which you will see shortly, she is our agenic medical partner, helps surface the insights that matter so the care teams can act faster and with more confidence. The simplest way that I'd say it is that HealthBook Plus helps turn fragmented data into human insight. And I know there's a lot of noise in the market right now around AI, and everybody's talking about AI. But for us, this is not AI for the sake of AI. This is not about throwing another shiny tool into an already busy workflow. This is about helping care teams spend less time hunting for information and more time helping people. That is, at the end of the day, the real value. For care navigation, we see this showing up in two major ways. The first is an in-the-moment navigation. Someone needs help. They may not know where to go. They may be confused about their benefits. They may not know if they need primary care, urgent care, behavioral health, a specialist, or any other resource. And in that moment, better information is going to lead to better routing. So if your team can see a more complete picture of that person, they can make a more informed decision and help get that person to the right place the first time. Now, the second area is ongoing care management. So this is the chronic condition support, the proactive reach, the care gap closure, patient engagement, and helping the team understand who needs attention first. A lot of high-cost events do not just appear out of nowhere, as I'm sure you all know. They're usually signals along the way. And the challenge is that those signals are often buried, delayed, or sitting in different systems. Now, HealthBook Plus is designed to help bring those signals forward earlier so teams can be more proactive instead of always reacting after something's already escalated. And I think that's really what gets me excited. We're not just helping people look at data, we're helping them act on it. The impact we're focused on is very practical. And we help organizations reduce time spent on record retrieval, chart review, and visit prep by up to 50%. In some workflows, work that may take 1 or 2 hours today can potentially be reduced to a much shorter review window, in some cases closer to 15 minutes. And that matters because it's not just about time saved, it's about capacity created. That is more time for outreach, more time for engagement, more time for intervention, and more time helping people get to the right care. So we're helping reduce patient data acquisition timelines from what has historically taken 2 to 7 months down to as little as 48 hours, depending on the environment and really the available access to that data. And when you combine faster data acquisition, less manual review, better routing, earlier intervention, and stronger reporting, that is where organizations can start building toward meaningful ROI. So depending on the model, the population and use case, we believe HealthBook Plus can help organizations achieve anywhere from a 4 to 10x return on investment. Now, the other thing I want to mention is that this is not just theoretical for us. So we recently announced a strategic partnership with Avel eCare, who is one of the country's leading virtual health systems. And through partnerships, HealthBook Plus and Page is actually being integrated into Avel's virtual health system to bring clinical intelligence directly into the workflows clinicians are already using today. And this is exactly how we think about this. We're not trying to pull care teams away from how they work. We're trying to make the workflow smarter and bring the right insights into the moment where decisions are being made. So as Ryan is walking through this demo, the main thing I'd ask you to keep in mind is your own workflow. Think about where your team is losing time today. Think about where visibility could help identify risk earlier. Think about where faster access to patient story could improve routing, any engagement and outcomes. And think about where a clearer data story could help you show more valuable resources to employers, to plans, and partners. And with that, I know that was a lot. I'm going to hand it over to Ryan. So Ryan's going to start inside the clinician portal, and where your team is going to be able to see the full patient story. You're going to be able to identify risk, prioritize next steps, and route to the right care. And then I'll move into the patient experience and show how HealthBook Plus keeps the individual connected and engaged between interactions. So that's going to wrap it up for me for now. So with that, I'm going to hand it over to Ryan. Ryan, take it away.
Yeah, thanks, Brad. Really appreciate it. And I'll kind of just start by double tapping on something that Brad talked about in that, at the foundation of what we do is really building an incredible understanding of any given patient. And we do this in a lot of variety of ways with different customers of ours, but a lot of it usually starts with what we call the point of service data, which is what most people think of when they think of healthcare data. These are those medical records, the pharmacy records, the claims, the all of that, the labs, all of that data that people are used to going out and hunting for and trying to find and trying to make sense of. We're really expert at going out and not only getting all of that information, but then being able to present it to our AI health partner Page in a way that she can be hyper useful and really deliver insights out to people's teams that up level them in the form of care that they can provide and the time that they can save in parsing through those records and understanding that. And so all of that data really serves as a good part of the foundation. And we've got some customers that bring a lot of that data to the table with us. And so they come to us with a packet of, 30 health record PDFs that they've gotten and say, hey, our nurses are having to skim through these and spend an hour making sense of all of this and pulling out the relevant information for our care navigation purposes. So we can take it from that end, give all of that information from Paige, and with the 5 years of training she has with working with these medical records, time and time again, when we show this solution to people and test it on their own data, we come out the clear winner over and over, even if they're looking at multiple different solutions. So that's kind of the most basic level of point of service data, which is, hey, if you've got information that you're just struggling to parse, send it across to Paige. I'm telling you, Paige will make sense of it all, make your team hyper efficient, and then also raise insights that you probably wouldn't have even considered. But that goes all the way up through. We've also got links into the National Health Information Exchanges. We've got SureScripts integrations. And so we've got these sort of more automated ways for us to be able to go out and grab records or grab pharmacy data or grab laboratory data on your behalf. And so if you're struggling also just being able to find the information that's relevant to your patients, we can really help in that way as well, in that we can go out there and get that information and make it useful for your team incredibly quickly. So you're no longer spending time hunting for records, spending time trying to make sense of those records, spending time trying to pull out any relevant data. Everything just comes down to, well, why don't you just ask Paige? And so that's why you'll see here, there's a lot of tabs in our clinician portal that you see here, but really right up front, you've got Paige sitting there looking at you, ready to help. And the use of Paige, like we call her that AI medical partner, really think about her as that partner. We had a customer recently that described her as, back in the day, I used to have 4 or 5, 6 doctors that were all practicing in my office, and I would be able to go into a break room with them and talk about a case that I was struggling with or bounce ideas off of them. This clinician was like, Paige is now kind of filling that role for me, right? I can bounce ideas off of her. I can ask her her opinion on things. I can ask her to generate a care plan for me. So anything from the most basic of questions, which I'll show, looking for specific records, give me details of Ryan's ER visit from December. So at the most basic level, Paige can go out and find the individual health records that I was looking for, summarize those for me. And you'll see these come across, but then you can really take it a step further. Okay, I see a lab in here that's really concerning to me. I'm going to trend that over the last year. Let's go a step further than that. Let's correlate this patient's labs with how they've been feeling, with any other conditions that they're experiencing, or hey, let's plot their HbA1c against their weight and see how those are correlating. So really the potential for using Paige, you could take her, as far as you can think to take her. And we're hearing day to day all the time of new ways to be able to leverage Paige. And so when you have this really wealth of information that we're able to come in and being able to then generate insights off of it, that's when those hour and a half long processes come down to 10, 15, 5 minutes that we hear time and time again of, hey, I'm no longer faxing for records. I'm no longer having to read 100 pages. I'm asking Paige a question. She's giving me an answer. I'm then asking follow-up questions. And it's just this much more cooperative. And honestly, we hear oftentimes that it's a lot more fun and a lot more enjoyable and a lot more engaging, being able to do their job, because they're not just sitting there hunting for information time and time again. And so that's really the power of Paige when we just think about the point of service data, so that healthcare data side of the house. But like Brad mentioned, we also do have a mobile application, and where the system can really be taken to the next level is if you start getting these patients engaged in their own care as well. And so if you provide that mobile application, which I'll show you here shortly, out to those patients, they begin generating what we call point of living data. So this is getting a really good understanding of what's going on with them on a day-to-day basis between those visits or between those encounters that you're having with them. And a lot of what's happening day to day is really what's serving as the foundation of people's health, right? It's not necessarily every 3 months when they happen to present in a healthcare environment. It's really, okay, are they struggling, with their diet day to day? Are they getting any exercise, or are they sedentary? Are they struggling with mental health? What's going on with them on a day-to-day basis? And when you get to that level, and between Paige being trained in lifestyle medicine and all of the data that we're collecting, we're actually able to really make some foundational changes in people's health. And all of that extra data, that point of living data that I'm talking about, then also feeds into Paige. Paige is aware of all of it. So as you're engaging with Paige here, you could also see how things are going over time, right? So, this ER visit was for gastrointestinal issues. I could ask, how has Ryan's stomach been since the ER visit, right? So now this just takes it to the next level. I can see how this person's doing over time. I can give them instructions when they're outside the office. And as they go out into the real world, they continue generating this more complete picture, but also they have the tools in their day-to-day life to continue making strides on their health. And so whether you've got your own mobile application and you're really just interested in the clinical intelligence that can be offered by Page, all the way through to being able to leverage this entire solution, the level of care that you can provide, the speed that you can work with, and the capacity that Page can add is really incredibly valuable for the companies that we work with. And so you can kind of see the real power of Paige in here. Like I said, you can take her kind of to the nth degree of complexity. We've done custom integrations with her. We've done custom prompting, prompt libraries to make sure that individual, whether that be cancer management or diabetes management, whatever those whatever priority or condition that you're focused on, we can really support those appropriately in partnering in some of these solutions. And so as we talk about kind of shifting on the patient side, right, after these visits, or let's say you've had a virtual visit with these individuals within our app, as you send them out into the real world, there's kind of two ways that you can keep them on track via our mobile application. One, you can provide any patient instructions that you have for them. I really need you to go see an in-person cardiologist, or, hey, let's focus on these lifestyle-based approaches. Let's focus on your exercise, document how you're feeling day to day on your chemo, whatever that is. You can put these in the patient instructions, and then as they go out into the real world, they start getting journal prompts related to what you assign to them. They get information, they get engagement. All of that's happening kind of automatically, where you're not having to maintain that. That relationship is really just being fostered day to day by Paige. In part two, we've also got a really cool new feature called Journeys, which you can think of as programming, but the really incredible thing about this is it's programming that's customized to each and every individual's health situation. And so if I'm delivering a diabetes program out to a population, that population, while they all might be diabetic, they've got any number of comorbidities. You've got some that are controlled, some that are uncontrolled, some that struggle on the nutrition front, some that struggle on the exercise front. And so Paige, as she's delivering this content out to them, is also aware of their complete health picture. And so as they're engaging on this content, for instance, maybe watching a video, anytime that they're engaging, Paige is right there to customize it and make it relevant for them in their own health situation. And so all of that information is always right there with them. Another thing I'll mention before we switch over and I show you the patient mobile app, well, two things. One, we've also got an AI scribe that's integrated, and so we've seen that fit super well into a lot of workflows as well. And so as you're communicating with your patients, you're having these virtual visits, our scribe can be listening in the background and generating your notes in exactly the way that you want them generated. So she does an incredible job of really, we can take a template, we can take exactly your gold standard note, and we can train the system to generate your notes in that fashion. And we've had just incredible success with that, and people saying the time savings that can offer. And then part two is that a lot of times what we hear in care navigation is that it's really difficult for people to identify early enough that people have the condition that they're targeting or are on the medicine that they're targeting, or it's just really hard from claim scrubs that might be super outdated to really be able to identify those individuals that need help. And so we've got a bunch of different ways to help in early identification, to really give you additional resources on top of your claims. That can be, if the right relationships are in place, the medical records. We can also do some of that off of pharmacy data, which can be a really early indicator. And so just moral of the story, whether you have the patient or the employee involved, as is, even if you don't have them involved, we can really help with early identification. But where that early identification can really shine, and as I make the transition over into the patient app, is because we've got all of this information and the patients are in the app and being able to engage in their health, they can also be sent to your solutions at appropriate times as well. And so if we roll this out across employer populations, which we've done, for instance, the system can see, oh, this patient's got diabetes, they've also got a heart condition, they need to gain access, or I'm going to recommend to these patients or to these employees that they join these two care navigation programs, right? And so page within here, we can load up anything within their that's offered by their employer in terms of point solutions. We can load those in here. Page can be trained on what's available, and then she can actually proactively provide that context out to the employee right when they need it. So, a new musculoskeletal diagnosis comes through. Okay, here's your partnered musculoskeletal care navigation provider or telehealth provider. All of that can be trained in here. So as you're thinking about targeting different employer populations, working with consultants, working with brokers, this can really serve as that foundational layer that ties together a complete benefits offering. And Paige also gets trained on the actual plan itself. So as this is being rolled out to populations, especially going into next year, we're planning on a lot of our customers are going to use this for open enrollment, right? So the employee comes in here, they see all of their health data, they have this great wellness and health navigation experience. But then if they ever have a question on benefits, they're right here in here as well. As soon as they get diagnosed with something new that might be appropriate for your care navigation company, they're redirected directly into your system. And so it can really act as that connective tissue that holds benefits together with the care navigation or the point solutions that employers are trying to offer to their employees, which just makes this such an incredible solution. And all of that's on top of just the core wellness and health value of the system direct to those employees as well. So all of that data from the point of service, all those health records are also available to the individual themselves. And so as they move through their lives and perhaps end up in a new health system or go to a new specialist, they've got all of their information with them. And so when they go in there, they can output all of that information over to that new health system or that new specialist. And now they're starting with a much better understanding of who this person is walking into the office. For instance, when I had that ER visit back in December, it was in a new health system that I had never been to before. And, after about 3 minutes of triaging, they immediately jumped into treatment, and they really knew nothing about my history. They didn't understand that what I was experiencing had actually been going on for 6 to 9 months before I ended up in the ER. So it wasn't just this little acute thing. And in that case, I was able to export my record to them and the summary of all of my point of living data. So what I had been journaling about, all of this discomfort I had been experiencing, and provide that out to them. And of course, that's just incredibly valuable information in the way that they treated me. Additionally, those employees get day-to-day engagement from Paige on their health as well. So this can be, identifying trends in their steps and how it might be influencing their sleep, or hey, you've got these 3 medical conditions, you're on these 2 medications, they actually don't play well together, you've been talking about how tired you are, well, here's how this medication might be impacting it, and here's some lifestyle medicine-based approaches to really combat your fatigue. So Paige is really just there day to day, giving them insights on their health, but also helping them along in their journey. And like I just talked about from the clinician portal side of the house, they can be assigned to any number of journeys. They can be in here, digesting this content, making positive strides on their health. And they've always got this AI partner, their AI health partner Paige, right there in the background to help them understand the content, personalize it, make sense of it, and apply it to their own lives. And since I'm on the topic of Paige, instead of them going out to ChatGPT or Dr. Google that really knows nothing about them, Paige is in here. She's got all of their health data. She's got all of their benefits data. She knows what point solutions are available to them. And so as they engage in their health, they can also ask any questions. They can be directed appropriately. Let's say as part of an employer plan, they've got a direct pay approach, and they're really focused on keeping patients out of the ER, out of urgent care, leveraging direct primary care, for instance. Paige can be trained on all of that. And so all of these um, solutions that these employers are putting in place that are sometimes struggling to deliver the ROI that they know they can deliver is simply because the employees don't know when to access those services or what's available to them. And so Paige can really be that all-knowing partner in their health that is then directing them at appropriate times into all of those different solutions. They can do telehealth with you right from within the app. We've got a conversations platform. So let's say they're in there and they have an hour-long conversation with Paige. At any point, they can loop their care team into that conversation. So I'm a cancer patient. I'm wondering about these new treatments that have come out. I can have an hour-long conversation with Paige on those treatments. At any time, I can say, hey, can you loop in my cancer navigation company? And from there, Paige will loop you all into that conversation along with a summary of what the conversation was about. And so, just as one example of this, I can be in here trying to figure out how to recover from the stomach issues I was having. I go back and forth with Paige. She builds a care plan. At any point, I can loop in my clinician. And from there, Paige buttons up that whole conversation, pulls in any related health records, any related health data. And so when it comes across your desk as you're navigating these individuals, you've got kind of a full understanding of what's going on, what they're asking about, and can jump in and out very quickly, right? So you know why you agree, you don't agree. Hey, let's hop in a telehealth call. Hey, I think you're going down a really good path. I'll actually look into that clinical study for you. It just makes the communications also incredibly efficient as well. And so when we talk about all those time savings we're delivering, this is another piece where if you do have your patients leveraging the mobile application, it can also really streamline the way that you communicate with them, and how well supported they feel on a day-to-day basis. And so that's kind of a quick overview of not just the clinician portal and all of the value that can provide to your team from an efficiency basis, from the level of care that they can provide, from generating those care plans, understanding better what's going on in people's health, making connections between different things that are happening in their health. So that value that's being delivered to your clinical team, but then also the potential to be able to roll out the member application or the patient application out to the populations to navigate those individuals to your solutions at appropriate times, help their employers see additional value in the fact that the benefits are now making way more sense to their employee base, help them on their health day to day, not just within the scope of whatever you're directly navigating them on. And so when you combine both sides of the platform, you get incredible clinical efficiency. On the clinician portal side, you're providing better care, but then you're also navigating patients kind of proactively on the employee side as well. And so with that, I will wrap up there and see if there are any questions that any of this has raised for the group.
Yeah, I appreciate it, Ryan. So one question, I can take this one. How does this reduce the workload for our care team? Great question. So the biggest workload reduction actually comes from cutting down a lot of the manual work. So think about your record retrievals, your chart review, any visit prep. Really, today, a lot of care teams actually spend time hunting through records. Obviously, you're going through long documents, you're pulling information from different systems, trying to figure out what matters. We help to compress all that. So the goal is to reduce the time spent on record retrieval, chart review, and visit prep by up to 50%. So the value is not just saving time, it's really about helping to create capacity so that your team can actually spend more time on outreach, engagement, intervention, and helping patients get to the right care. Here's a question for you, Ryan. Do you integrate directly with EHRs?
Yeah, so we have EHR integrations on the member side, so on the application side, where people can log in to, let's say, their MyChart if it's not coming across the networks automatically, and can pull down their records into the system. We have also, depending upon the customer, definitely built, API-based integrations into their systems. For instance, we've had sometimes where their system's just sending over the data packets into ours, pages running on those packets and delivering back a set number of prompts and answers over into their system. And so, yes to both. We can do it in multiple different ways with the way that we work alongside or inside of EHRs.
Cool. I'll take this one. What kind of organizations are usually the best fit? It's a great question. The best fit is usually going to be an organization that's trying to scale care navigation, any type of care management, virtual care, employer health programs. I think the common thread that we're seeing is that they're dealing with fragmented data, obviously manual review, patient engagement challenges, really pressure to build value, improve value. So that could be a care navigation company, virtual care organization, a population health team, really anybody, including a provider organization that may be supporting complex patients as well. Ryan, how do you handle the data from multiple EHRs or multiple providers? Either you could take this or I can. It's up to you.
Yeah, no, I can take that.
Sure.
That's kind of the beauty of leveraging AI, and with all the experience that we have over the course of the last 5 years, we started processing this abundance of EHR and health record data 5 years ago, kind of before AI was a real thing. So the great thing is we worked a lot on normalization, on processing all of that disparate information that's coming from a variety of sources into a system that originally was for human readable format, but now is just super well set up to be able to feed into our AI. And so that's allowed us to really provide a clinical intelligence performance level that is just way above and beyond what we've seen from other players in the market. So more of the story with AI being so powerful, we're able to really, normalize all of that information and drive insights out of kind of whatever the data source is, whatever format it's coming across in.
Yeah. Here's one I'll take. How does this support chronic condition management? Geez, good questions today. This is awesome. Chronic condition management really is going to depend on understanding what is actually happening over time. So, as you've probably seen throughout this entire presentation, is HealthBook Plus. We're going to help care teams look beyond a single encounter and see more of that longitudinal picture of the patient. So that can include clinical history, patient-reported information, any care gaps, and other real-world health signals that they might be getting from the wearables. I think that the goal is to really help teams identify who might be trending in the wrong direction, who may need outreach, and really where intervention can happen. So hopefully that answered your question.
I'll
Yeah.
add one more point to that. Just in that, if you are leveraging the patient application or the member application, then you can send them off into the real world with some real substantive instruction and support. And so you're not just, giving them a flyer or a program to try to follow along as they have time. They've really got a partner in their health day to day. And
Yeah.
so, yeah, kind of closing that loop as the patient is leaving your visit or your encounter and going off on their own is also a real value that we see with some of our partners that do leverage that mobile application.
Okay. How is your data secured?
Yeah, so we've got kind of every gold standard, certificate and audit done. So SOC 2 and
ISO.
ISO
Yeah.
and HIPAA compliant, GDPR compliant. So yeah, we're very serious about that. We keep everything in HIPAA protected data storage, and nothing goes out to go train models or do anything like that. So we take privacy very seriously.
And then we got two more, which I think are, you could take them both. So it's two for one. Who owns the patient data and where is this data hosted?
Yeah, so all the data is hosted in a HIPAA compliant AWS instance that's locked down for our organization, have all the BAAs in place to make all of that compliant. At the end of the day, if the patient is involved, they own their own data, right? So we do allow individuals that are in our system to reach out and, say, I want out of the system. I want you to destroy my data. And we do comply with that. Now, in the cases where it's a care navigation organization that's really leading the charge and the employee isn't necessarily um, in the mobile application, they're not the core customer. At that point, much like you going out and gathering records from various hospitals and faxing and bringing all that data in, you've got access to that. So, yeah, hopefully that answers the question.
Yeah, I think, let me look at this app. Yeah, I think that's everything.
Awesome.
Yeah. So before we do wrap, I just want to say thank you again for really spending the time with us today. I know everybody's busy. I know there's a lot of companies talking about AI, a lot of them talking about navigation, engagement, and cost savings right now. But at the end of the day, what excites us about HealthBook Plus is that we're really focused on solving a very real, very practical problem. Obviously, care teams need faster access to the patient story. Patients need clearer guidance. Employers and plans need a better way to see value. And that is really where we believe HealthBook Plus can really make an impact. By bringing in the patient story all together, surfacing those insights through Page, and then helping care teams route, engage, and intervene faster, and ultimately deliver a better experience for both the care team and the patient. I really think there's some value here. So um, if anything we showed today connects with what your team is working through, we'd love to continue the conversation. The best next step is definitely a deeper workflow discussion where we can really learn about your population, your team, what you guys are building, any of your current processes, and really where HealthBook Plus might be able to create the most value. So on behalf of me, Ryan, and everybody here at HealthBook Plus, thanks again for joining us. We appreciate your time, and we're excited to keep the conversations going.